in our endeavors to do our best. So that's our new logo out there, everyone. We'll continually talk about it as we move forward, but we just wanted to introduce you to our logo and our purpose and tying it in together. Anything you want to say? No? Okay. All right, everyone. Let's move on to item number 5, the announcement of the release of our annual report.
All right, everyone. So our 2025 annual report can be found on our public website. And Gord, if you don't mind putting a link into the chat so people can see it. But basically, this has been a very large year for the commission. And much of that reason is because we were able to grow our team in really significant ways. We were able to hire 2 new investigators, which we've never had before. One for the jails, one for the prisons. And so for us to really get a hold on, diving into our investigative processes and creating the policies and procedures in the case management system and, really starting to dive into the huge backlog of cases that we have has been monumental for us. We were able to start digging more into deaths in custody. And so what the annual report covers is, of course, a basic introduction where you can meet the commissioners and the staff. It covers how many public reports we've had, where to find all that information, all of our meetings. And then it also covers death in custody by ethnicity, age, facility, and length of stay in months, classification, and custody status, and then also the description of each individual death. In 2025, we had 16. And so this is kind of a brief preview of what many of our priorities will be for this upcoming year, with really digging into more of that data. But we also covered how the commission has been in the media, our facility tours, whether it be general facility tours or more specific or like special tours, our events that we've attended, our facility specific issues where we break down each facility, what we're seeing, what our concerns are. We covered conferences, whether it be local or national, and then also legislative priorities, legislation, and then looking into 2026 and beyond. A part of that was updating our strategic priorities for reentry, which I'll talk about in just a second. But also, looking forward again for 2026, it's really going to be a focus on our investigative processes. And so again, getting into all these facilities, speaking to people on a one-on-one individual basis, getting into this backlog of cases, and then continuing our commitment to really overseeing reentry, overseeing the movement throughout the system or the lack thereof. And so we're really, really proud of the work that we have done in the past year, and we hope you are too. For the reentry oversight strategic plan, just a brief overview. So in 2023, we released our first strategic plan that was really specific to how we're going to oversee reentry. And that strategic plan really helped us put together our Hawaii Mile report, which we released last year, which really covered the current state of reentry in the state of Hawaii. In 2025, we hired our first reentry oversight specialist, whose work was informed by not only her lived experience as a formerly incarcerated individual, but also as a Native Hawaiian. And so we really wanted her to take her perspective and her critical insight and her realities of reentry and really incorporate it into the plan. And so with that said, the 2023 plan was updated to really intentionally reflect cultural importance, lived experience of those in custody, and also equity in reentry. And so when you go through the plan, I think it'll speak for itself, but I'm really, really proud of what our reentry oversight specialist, Kitty Takata, was able to put together. I think it's going to put us on a great track as we continue that work in reentry oversight. And so that strategic plan is also on our website, and you can check it out at any time. And as always, if you have any questions or comments or concerns for us, you can always reach out to us.
Thank you. That's Is there any comment from the public on the annual report as presented by Kristen at this time? Or the reentry report? Okay, commissioners, any comments?
I would like to address in the reentry report on page 8, talks about population limits. This is one part of the law. We are required to establish maximum inmate population limits for each correctional facility and formulate policies and procedures to prevent the inmate population from exceeding the capacity of each correctional facility. The department embarked on that in 2000 and 2001, and I was the person assigned to come up with those limits. I was trained by Curtis Pulitzer in how to do it, and then I did the analysis. I worked very closely, like with the Board of Water Supply, Hawaiian Electric, and others, and then the operation managers for each of the facilities. What we look at and what we include, our 2001 report is on the website, our website. It required us to understand, is there enough water coming into the facility? Is there enough sewer capacity? We have expanded since that report 2 areas just recently. One is a very large new housing at the women's facility, and the second is new housing at HCCC. And I have informed Kristen that I would help come up with those capacities, but they're going to be very limited because really all we can look at is the space available and compare it to American Correctional Association on principles and how we should be using the space. I will not be able to assess the support services that are needed. So I don't know whether the addition to HCCC actually has the ability through electricity, through sewer and water to support that new unit. So we're hoping to get eventually some funds from the legislature that we can once again hire a company to come in and do the analysis for us. But unfortunately, we have been limited because we don't really have the capacity right now to do a complete one. So we will be doing a very limited analysis and hope in the future that we'll have a good analysis of population limits and we establish that for the facilities. Thank you.
Any other comments, commissioners? Okay, hearing none, we'll move on to item number 6 on the agenda. Good morning, Sana. Are you there?
Sana and Melanie, let me go ahead.
Tommy Johnson was not able to be here today, so we have Sana Munoz, Deputy Director of Rehabilitation, with us this morning. Morning, Sana.
Good morning, everybody. Happy New Year. I just have a few short updates, and that's just regarding the upcoming event. Today at Kulani, there is a substance abuse outpatient graduation occurring for 12 graduates. At Waialua on January 16th, there's an Inside Out Dad and 7 Habits of the Inside graduation. We also have an intensive outpatient graduation on January 23rd, and the cash box residential substance abuse treatment program graduation on January 30th. That's all I have.
Public comment is open for anything on the agenda regarding to CR and the report at this time. Help me out, Edward. Seeing no comment at this time from the public, I'll close that testimony. Commissioners, any discussion?
I have a question for Sana. Sana, this is Ron Ibarra. I would hope that you folks are sending invitations to the commission as a whole so that we can support you folks at these events. I know I live on a big island and you have events going on at HCCC, and I was glad they drive the 85 miles one way to attend to support you folks. So if you would be kind enough to provide notice of these events, I'm sure not only on the big island, but throughout the state, so commission can decide whether we should attend or not.
I appreciate that, and we'll make sure we do that.
Sana, it was in the news that Tommy Johnson discussed that at the new facility that is being planned, that they are now eliminating the community-based housing and instead are going to expand Laumaka. I would like some more information on that because one thing that I was very pleased to see in expanding the community beds was that Tommy was considering parole violators and probation violators to be able to enter those beds also, not just sentence felons exiting the system. So could you comment on the decision to remove it from the planning process and instead focus on Laumaka?
And Martha, I'm not sure if you want me to respond to that right now, if you wanna do the, what people see, new jail presentation first.
Is there gonna be a new jail presentation?
Yes.
Oh, okay, I'll wait for that. Thank you.
Thank you.
As the first commission meeting, son, I guess this is more of a comment or request at the same time. We're about a week and a half away from the opening of the legislative session. And it would be good to know, DCR's plans for proposed bills or their budget and how we can help or assist you folks in your goals. This legislative session, we haven't heard anything that you folks are asking for in regards to bills and budget. And will need our assistance in testimony, et cetera, et cetera, et cetera. Yeah. So if you can relay the message to Tommy on any kind of that information about how can we be of support to the DCR in the upcoming legislative session in regards to your budget and the bills that you are presenting. Thank you.
Thank you.
Okay, we can go ahead with the presentation.
Okay, so I just wanted to introduce, and I hope that I say your names correctly. Please correct me if I get these wrong. But Chris Badosh and also Bettina Maynard. They're from Architects Hawaii Limited, also known as AHL, and they'll be presenting today on past planning, current state, and future planning of the new Oahu Community Correctional Center, also known as new OCCC. They are fabulous at what they do in general, and I really appreciate them just taking the time today to really go through the history and where we are now and for the future. I did want to note a couple of brief things that their presentation is going to be thorough, and I'm sure there's going to be a lot of questions. When we open up for public comment, we just wanted to remind the public that your questions are actually supposed to be towards the commission, and so not AHL. Once we close public comment, then the commissioners will have the opportunity to ask more questions or look for more clarity or have discussions in general. But that's kind of the structure of the meetings in accordance to the Sunshine Law. So I just wanted to remind everybody of that. But again, thank you both so much for taking the time and being here, and we're really looking forward to the presentation.
Thank you very much for that introduction. Good morning, everybody, Chair Atkinson, members of the Commission, President, and members of the public. My name is Bettina Maynard, and I am the principal in charge of the design team. We appreciate the opportunity to present an overview of the new Oahu Jail project. I've always considered it a privilege to work on this project, so thank you. In the next 18 or so minutes, we will give a brief recap of where we started, how far this project has come, and where we are right now. And while it might be redundant given today's audience, this slide here is important because it reminds us that the jail and the prison are two very different facility types. OCCC is a jail that houses individuals who were arrested, who are awaiting sentencing, or have been sentenced for minor crimes. In the state of Hawaii, the Department of Corrections and Rehabilitation, DCR, operates both jails and prisons under a unified system. OCCC's history spans over 100 years and dates to 1916 on its current site in Kaliki. In 1998, so already over 20 years ago, the Hawaii's Correctional Action Plan highlighted the need to replace OCCC, and then 5 years later, in 2003, the Corrections Master Plan update reiterated that we need to replace the facility. The OCCC is old. Most of the facilities in Hawaii are. OCCC's replacement represents the largest public works project in the state of Hawaii as it relates to prisons and jails. There's a universal agreement that the current facility is antiquated. It is dilapidated and it is obsolete. As a result, it is costly to maintain and operate. And as a detention facility, it's not adequate, or frankly, even appropriate to house and assist inmates. I'd like to highlight 4 main points. The new facility will allow us to better, frankly, more appropriately address detainees with special needs, including those with medical and mental health needs. It will allow those who require protective as well as maximum custody to be housed separately from the general population. And a new building will not only greatly improve the living conditions of the inmates, but it will provide a more secure, efficient work environment for corrections staff. And then lastly, it will provide an environment where the focus is on better preparing inmates for successful reintegration into the community. I should note here that the replacement of OCCC required the expansion of WCCC in Kailua. That was completed in January of last year. As the female population is now housed entirely in Kailua, the intent is to provide better gender-specific services. So in essence, the new facility aims to improve physical, social, therapeutic environments to inmates. It will improve working conditions and safety for employees. It seeks to increase community partnership for programs and volunteer organizations. And it will provide better visitation experience for family members and friends. In regards to the building, the new facility means a reduction of repair and maintenance needs, and therefore substantial increase in operational efficiency. Ultimately, the new jail will serve as a catalyst for improving the correctional infrastructure in our state. Now let's look at the 3 phases that this project has been going through. In the 4 decades long effort to replace this facility, no other team has been able to advance the replacement effort as much as we all have. So let's look at where we've been. Here are some highlights of the first phase. 12 potential sites for the new jail were identified and evaluated based on criteria such as existing infrastructure, proximity to courts and other facilities such as medical, community services and support, that includes acceptance, land ownership, property acquisition, site topography. You get the idea. The current animal quarantine station site emerged as the preferred option. So part of the planning process was the application for PRU. The PRU is short for Plan Review Use. is a city zoning designation for projects that need special review. Those include hospitals, prisons, jails. It requires a submission of detailed master plans covering future expansion, density, landscape, and more. The PRU for the new Oahu Trail was approved by the city council in 2020. And here is a Google Earth image of the old animal quarantine station site. The red arrow to the left shows the point of entry. To the left of the H3 overpass are various state buildings, such as UH, and wastewater treatment facility, and the DLNR maintenance facility. The red outline indicates the area that's to be used for redevelopment. This here is a different view of the site showing zoning detail. Most of the site is zoned for industrial use, and there's some residential. The pink is the industrial, the light yellow is the residential. Maximum height, our site is 90 feet. The setback on all sides, front, back, and the side, is 50 feet. Here's another view of our site. This one shows existing uses. The site houses animal quarantine, enclosures and facilities, for parking lots, and various other uses, including the sheriff's canine unit. The majority of the animals that we see on towards the bottom of the site will be demolished and they're not have been in use for many years. The large animal holding facilities will remain. However, for the new trail to start construction, the current animal quarantine office building will need to be relocated. That project is independently designed and funded. Its new location will be on the other side of the H3 freeway, in close proximity of other animal quarantine station buildings. Also part of phase one was starting the development of population forecast. The first forecast was done in 2016 for a 10-year period. Scheduled second report was done 5 years later. The 2021 forecast update showed the need for 1,012 beds for male needs by 2024, then declining by over 100 beds within the next 8 years. It's into 2032. The note here. Ongoing discussions and calls for real reform might ultimately reduce the overall size of the facility, but it does not eliminate the need for it. And as you can see, we are not expanding the number of beds. The population forecast will be updated again during the design phase to ensure that the right develops the facility that best meets its needs. Also evidence that opportunities to review and revise the plan for occupancy will continue to occur throughout the design phase. The new Oahu Trail needs to accommodate widely divergent populations. They fall into rated and non-rated categories, as well as various types of medical needs. The point of this slide is that a well-functioning facility has more than one bed type per inmate. Therefore, it's not 100% occupied at all. Phase two. That started in 2020, took about 4 years to complete. Build engineering studies. We also, for the first time, reached out to the development community to test this type of project. Phase two accomplishment. I would point out
There's excess stuff. this screen was being blocked a little bit by some excess stuff. I'm just asking George to get rid of it. Okay, it's back.
Great, thank you. I'd like to point out that since 2016, we have presented at every IDEA neighborhood board as well as IDEA Community Association meeting. We had 2 island-wide on all meetings. We have a dedicated advocacy website with all of the public outreach material, all the technical reports available for download. We so far published 52 newsletters, which are distributed to over 1,800 stakeholders. And those are elected officials, agencies, public entities, development professionals, and frankly, just about any individual that expresses interest in this project. And lastly, there have been several opinion editorials, media interviews, most recently by ECR Director Johnson. Phase 3 is where we currently are. Our team was fortunate to have been selected for the 3rd phase of this project. Since then, our engineering partners focused on site-specific issues. The team reconfirmed the programming with our leadership, and we have completed the conceptual design phases. So currently, we are in the schematic design phase. We have completed a value for money analysis, which ensures the financial implications are clear. This report is also important as it reminds us of the value of the proposed P3 delivery method. More on that in a minute. Our team, which includes DAGs, ECR, DHL, and its consultants, attended 4 ACA conferences to gauge developer interest and answer questions. Here at home, we continue our community outreach and engagement. This project team published the OCCC newsletter. What you see here is newsletter number 62. In 2025, we published 5 newsletters. We are now working on number 63. Earlier in 2025, Board and Shell, as well as you, Kristen, were invited to a roundtable discussion with PBS Insights about the new Oahu jail. Topics discussed included current conditions at the jail, mental health resources, the selected site, ECR staff health and wellness, maintenance expectations of the jail, and community involvement. You can check out the video on PBS or YouTube. The ACA conferences, the American Correctional Association events are held twice a year. We have been attending those for the past 2 years. This is the leading national conference on corrections across America. Events like this are used to connect with the development industry and gauge interest in developing a jail like ours. Incidentally, our project was selected as one of the top 6 projects to watch in the year 2025. Something to be quite proud of. This past holiday season, DCR and the new Oahu jail team participated in the IAR holiday parade and fun fair. Board and Shell and other DCR employees were part of the parade. We had a chance with DCR spreading awareness of the new jail. Pivoting a little bit here. There are costs associated with not moving forward. Essentially, it's the cost of doing nothing. The building itself is old and decrepit, but so are its components, which include mechanical systems and security. Remain operational, they need to be maintained and eventually replaced, which is extremely costly. The current facility has struggled with employee morale and attendance before the pandemic. Staff shortages are forming. a safer as well as a healthier work environment will decrease staff turnover, and it might even become a recruiting tool. All of this amounts to an economic and a humanitarian cost. Estimated construction cost in 2018 was $525 million. That price did include the cost of construction of the new animal quarantine station as well. The current cost index for Honolulu is at 4.6% escalation. It's the second highest in the nation. The Breweries, Washington, D.C. is at the top with 8.8%. At that rate, the cost of doing nothing, actually waiting, will add over $20 million to the price tag of the facility annually. That assumes that the escalation rate does not increase. On a side note, the business case analysis, which was completed during the first phase in March of 2021, anticipated a cost escalation of 6%, which translates into $31.5 million annually. The next cost estimate was completed in mid-2023, coming in over $900 million, 900 million. Lastly, OCCC is currently located on parcels with significant economic development value and opportunity. Development of that area will, without question, lead to significant tax revenues, not to mention the vitality to the neighborhood that comes with economic revitalization. Part of our outreach has been about the procurement method. For this here are our team presenting to the Hawaii legislature. Speaking of procurement, Hawaii announced that the project was expected to move forward as a P3, private-public partnership. The delivery model is a design, build, finance, maintain model. Here, a single team is hired to design, to build, and finance the entire project. So over the life of the lease, money is paid back to the developer with the interest of the lease term. Maintenance of the building and its component is performed by a third party. So it is important to point out that under any scenario, ECR and its staff will continue to operate and manage the facility and the population it houses. It will never be a private facility. This here is a conceptual rendering of the new OCCC entrance. This is subject to change. It looks a lot more complete than it is. The design team continues to move forward with the schematic design. We are currently hosting regularly scheduled workshops with ECR and DAG, and other user groups to further develop the site and the facility. As the workshops continue and the design is refined, we will be sharing more information on the status of the project. What you are seeing here is very hot off the press at the very latest rendering. The project timeline. This is a schedule scenario looking ahead. It very broadly outlines the details of what is part of the next stage of the project. In essence, the team will develop the bridging document that will be the foundation for the future developers' proposals. It is anticipated that the project will receive approval to allow it to move forward. Phase project completion currently anticipated to be in late 2031, early 32. And that concludes our update. Here is a link to the project website. I encourage everybody to please check it out regularly. It is It is updated frequently. You also can see a video featuring the government in support of our project on that site. And thank you for allowing us to present this project. Open to comment.
Thank you so much for that, for this time. Want to open it up for public comment. Just a reminder that we have a 2-minute time limit on public testimony. And your remarks and your questions, please direct to ourselves. We will write them down and we will ask our questions as we discuss it as a commission. So at this time, I'm opening up for public testimony.
Hello,
Good morning, Kat.
this is Barbara. Cole.
Okay, go ahead, Barbara.
Okay, I woke up this morning to an email from the Council of State Governments Justice Center, and I am wondering whether the department or the members of the council see this material. It's about the Reentry 2030 project. I worry about the way the jail is being put together. And I want to know whether it now will allow in-person visits to people who are incarcerated there. Thank you.
Thank you, Barbara. Kat, good morning.
You're muted,
Good
Kat.
morning, Commissioners. Catherine.
We can hear you now. You're good.
We can hear you, Kat.
Okay. Good morning, Commissioners and members of the public who've been deeply involved in this project. The first thing I'd like to point out is I find it disturbing that the new building will reduce maintenance. Well, we're in this mess because of lack of maintenance. And that is why all our facilities are in terrible shape for lack of maintenance. So to say this new building is going to improve public safety is kind of ridiculous because a building is not going to improve public safety. Actually, training of the staff who works with people who are incarcerated, that is what actually improves public safety. So when we think that the new building is just going to solve all our problems, it's naive and expensive. The community has stepped forward in many, many ways to recommend things that we could do right now because lots of the people who are in OCCC would be better served in community programs. And instead of building this new thing, to say this is going to improve everything, that is disrespectful of the community. And the department, for some reason, is very averse to actually meeting directly with the community. So what they did was they had a big contract with and UH came up with some really terrific ideas that are not represented in anything that was presented before. So that is a huge problem for us and the community resents being the wallet that is going to pay for all this with no real input. Thank you.
Thank you, Kat. Anyone else? Ms. Fernandez?
Good morning. This on behalf of the City Politely. I was wondering if you can share a more exact breakdown of how the tens of millions of dollars requested by DCR in the past years for the purpose of planning the jail is going to be spent, and whether and the extent to which conversations already occurred with potential contractors for the design and financing of the facility.
Can you repeat some of that, Amanda? I'm sorry, I didn't quite understand you. I'm trying to listen.
Sure, no, I'm just, what I'm trying to get at is I'm wondering, if there are more specific breakdowns you've received from DCR about how the tens of billions of dollars for planning are going to be spent, like where exactly those dollars are going, in the planning process. And then also, if the commission, or DCR, to your knowledge, has already communicated with potential contractors, for the design and finance and maintenance of the facility, what the content of that communication is.
Thank you.
Thank you, Amanda.
Anyone else? Hi, Lauren.
Lauren Walker.
Hi, how are you, everyone? Thank you. Hi, Lauren Walker with Hawaii Friends of Restorative Justice. We would like to get actually, we understand that Tommy Johnson, he had testified at the legislature in the last couple of years that engineering study was conducted that showed renovation of the current OCCC was impossible. We would like to see this report, please. And I understand the ACLU did make a FOIA request for it and did not receive it. So could we get a copy of that report, please? It shows that OCCC, where it is right now, cannot be renovated. Thanks.
Thank you, Lauren.
Good morning, Carrie Ann.
Lauren, good morning, commissioners. I apologize about the camera. I am recovering from the flu. I'm speaking as a community member, also as an attorney. I'd just like to add some comments today and to follow up on what Lauren Walker just said, that to my knowledge and to the communities, there's been no alternative study, assessing the costs associated with renovation or partial renovation of the current location, despite a public records request made previously by the ACLU. This has been a repeated request at legislative hearings, even in this meeting, and nothing's ever been offered. There's also no evidence that the Department of Corrections and State have invested in data-driven incarceration and diversion strategies to reduce the pretrial population, which is a driver of the population at OCCC. We can learn lessons from both Maui and Hawaii. They have reduced the pretrial population at both MCCC, and KCC. And of note, MCCC at one time was considered the most overpopulated, overcrowded jail in the state. And at one point there was a push to build a larger compound on Maui, and the community said we want to invest in alternatives and community-driven programs. We can also look to lessons learned from decarcerating HYCF. At one point, that facility was overcrowded. There were some segments of the community who thought we should just build a larger expanded youth jail prison. Community members, including the following and others, said, no, let's invest in data-driven strategies, cultural competency lens, and we all know that incarceration has been sustained, lessons learned from there. This is not about rehabilitation. This is about money and development of this area. Because we should be looking at the segregation and mass. This is very confusing to the community because the governor on one hand is touting potentially the purchase of FBC, and this is simultaneously occurring. So what are actually the plans for the state? Thank you for the ability to provide comments.
Thank you, Carrie Ann.
Not seeing any other hand at this time. I'm gonna close the public testimony and open up discussion, commissioners.
Chris and Bettina, I just want to ask if you acknowledge about this. The maintenance will be contracted out, is my understanding. Is that correct? Because what? I'm sorry, what was that, Bettina?
That is correct.
And,
That
you know,
is correct.
and-
I'm sorry, I hesitated because I wasn't sure whether, Sana, would want to answer because I would follow her.
well, that's,
Yes,
I
that
just
is
wanted to make it clear that maintenance will be contracted out because as Kat brought up, the state of Hawaii is terrible at maintaining buildings. Not just correctional facilities, it's our schools, it's our offices, it's everything. And so I want to know if you have any knowledge from your experience, how have these contracted maintenance, how have these maintenance contracts worked in other areas? Are they successful in maintaining the buildings?
Of course, my answer is yes, we do feel strongly about this, as there is a contractual obligation by, the development team to maintain the building. Part of the contract of, or the agreement of the state with the developer is agreement on the definition to the level of how this facility would, need or want to, maintain. Say, at the end of the, let's say, 30-year lease term, the facility is in perfect condition.
Okay.
Does that make sense? Does it answer the question correctly?
Yeah, it answered the question. Better job than the state does, because the state does not do a good job, as Kat brought up. I also, can you expand by any chance? It really was Tommy's decision not to include the community-based beds anymore and instead focus on expanding on La Maca. Do you have any knowledge as to what led to that decision?
There were a couple of drivers to that. Sana might want to join in here as well. But one of the drivers is that La Maca is existing in the Kalihi neighborhood, and the Kalihi community has the infrastructure and the program to serve that community, and there is a tremendous value to that. There has also been some pushback from the IAR community who was unsure about transportation needs of those housed in the CTC in their community. So it seemed to be the best decision. Sana, do you want to add anything to that?
That's correct, Bettina and Micah. The infrastructure is already present there with the water, sewer, and electrical. Yeah, there's employment, and public transportation in that area. So we think that will make the building much less expensive.
The reason I'm bringing this up is the footprint for La Maca is fairly small. And as I mentioned earlier, Tommy had talked about using the community-based beds for parole violators and probation violators so they continue to work, which I like that idea very much. So if it's going to be, and there was never an intention to give up La Maca, that was going to continue to be part of the department. So how would that be expanded on that small footprint to allow more people than the 96 beds, which is currently the capacity? That's my question. Donna, you have any information on that? Go ahead, Sana.
Martha, sorry, I think there was something wrong with my printer, but, as you know, this is something that's relatively new, change. So we're still in the planning stages, so we don't have much information to provide you at this time.
So I just want to express that is a concern of mine because I like the idea of having probationers, violators, and parole violators included in that. And personally, I do have some concern about P3, and it has to be how the state pays back that. Because when we went for the bonds, And all the paying of the bonds was held by budget and finance and was not subjected to any budget reductions that may happen because of difference in finances and taxes coming into the state. Once we go into P3, the money will be given to the Department of Corrections and Rehabilitation to pay that bill. So it's just my personal concern. I don't expect an answer for this. I'm afraid that in the future, if there's a drop in the tax revenues and states have to cut their budget by like 10%, 8%, that they can't cut the money they're going to be using in paying the more effect programming. And that's just my personal take on that. I also want to correct one thing, Bettina, about the history. In the 1950s, none of the 1916 buildings were taken down. We continued to use those buildings until 1989, and in 1991, that old facility was destroyed. What happened in the 1950s is on the annex side, they had totally rebuilt the correctional industries for furniture making. Kulani was founded in 1946 for the purpose of being a logging camp for those correctional industries. So if you go up to Kulani, you can see this huge Quonset hut, one of the largest in the state, which was where they planed all the wood and stuff. So the wood was then shipped to Oahu. So I just want to make it clear the 1916 facility was not taken down. It was used until 1989.
I appreciate that, thank you. We'll find a way of including, appreciate it.
I do have one historic document that talks about the founding of Kulani. It was the 10-year report for the Department of Corrections or the Department of Institutions from 30s. And I think I have some other things. I used to be like the department historian, so I kept on looking up this stuff.
Oh, I was very interested in it, thank you.
Okay, sure.
Commissioners, any other questions?
Let's ask questions.
Go ahead, Mr. Bobby.
Thanks, Brown.
Ms. Graham, I want to thank you for your presentation. I thought it was an excellent presentation. And all the work that you've done. And I was wondering whether or not you could provide the commission with a copy of your PowerPoint. Is that possible?
We have it, yeah.
Okay, great. I also thought there was a comment made by members of the public, for important comments and points that need to be considered and thought about. I guess one of the questions that I specifically have is, just so I understand, and I totally want to say that I don't have any expertise in this matter, so if my questions are stupid, please forgive me. The design of this particular facility that you're building, is that design, you folks have created or creating that design based upon your interaction with some DCR and conversations with dads. Is that correct?
That is part of it, absolutely. We are following DCR's program. We have, this is very important. We also, the subject matter expert, if you will, on correctional facilities on our project. It's a large architecture firm, HO, they're an advisor to us. They are the leading global expert in correctional facilities. They're very, I think they are the leader from our perspective. Out with us. So we have insight into the new technologies. We can consider them, whether we implemented them or not. It's one thing. And your discussion that I was referring to with DCR and discussing if some of those are direction we want to go in some of those instances. So yes, there's a lot of that discussion, and it is driven by DCR.
Right. So what you're saying is that basically DCR is directing the sort of input that you get that creates whatever the design is that's coming out of this process. Is that correct?
The facility has to work for that.
Right, I understand. But the facility, you would agree, has to work for the community in the state, correct?
Correct.
I mean, DCR is just a caretaker. It's not, it's the community, the citizens, the state of Hawaii, the taxpayers, who essentially own the facility and need this facility to do something that accomplishes the goals that we wanted.
Yes, that's most correct. Yes.
All right. So those goals would include rehabilitation, all the business things that go into mental health, right?
Correct.
So have you done an analysis of everything systemically that hasn't worked at OCCC?
We are dependent on the information that we're being given.
Okay, so that's a no.
Oh, that is not, no, that
Okay.
is, I'm taking the end to this question already a little bit.
All right.
Because continue to stress the importance in this short presentation here. You know, I feel it's important to mention that we're work with those that have mental needs. And we,
You're asking me to take that on faith. And I appreciate what you're saying. And I really understand what you're saying. But I think what I'm trying to get to is the fact that as you make this, what are the values are you using to reflect how this place is supposed to work? Secondly, you know, how, as I said, are we incorporating all the very different problems that exist in OCCC and all the problems that exist in OCCC. Some of it has to do with building.
only one aspect of it. You're absolutely correct.
With your analysis of what doesn't work in the system, that could be corrected in some ways by whatever, but we could eliminate some of that and make it better by some of the designs that changes that you propose.
I strongly believe that the team that we have right now, and its openness to truly make a difference, to are we always having answers to all questions? No, it's important. The feedback that we're talking here today is very valuable. UHCDC, absolutely, we are considering their feedback. PCR embrace portions of that feedback of that report. It is, there's a lot going on. And I've been working on this project for 10 because of this dialogue, because of the impact that we have on the people that we're serving in these facilities. And there's a dedicated team all around that's very much PCR and our design team that it's, you know, kind of lower impact level, but we all want to do something really special here. And it's purely people driven.
Yeah, and I appreciate all of it. I really do. I think one of the just critical for the best in the first time. I'm trying to understand in my response to monumental consequence to the state as a whole, then on the side, how we proceed. I guess let me ask you a couple more questions. Do you folks have, is there for lack of a better term, some sort of philosophy about the design and system, as you think about how it's created, or as you make your plans and recommendations. You know, as you go forward, let me give you an example. I mean, this is sort of when we went into my background in conduct comparison to the other courts, about 10 plus years ago. And part of that facility building now included, or did include, still includes the detention home, or detention, which is a pretrial jail for youth, to replace the one that was built in homes. When they built that, they worked with DAD, and they worked with another governmental entity, not with the court or the judges or those in the juvenile justice system that had perspective. So my point is, the end result was that they built the facility completely out of touch, completely unrealistic for the needs of our community. And they built that, and it stays there, it stands there, and it's an impediment to juvenile justice reform and to mental health of kids that are acquitted. Because it looks like something out of Alphabet. Right. Now, I'm not saying that this is what you're doing. I'm saying my point is that I don't know. Because one of the things I do know, and this is why I asked the question, is that facility was built with no sense of what that correctional philosophy or judicial, or I'm just going to say correctional philosophy would be that reflected the value that we held as a community, as how we were going to deal and try to help kids. I don't hear a philosophy. In 1984, Chair Patterson wrote a letter to the governor, which laid out exactly what the position of the commission was, respective to the building of the new jail. Was it 2024? I guess it was.
Yeah.
And that letter stated that we have to come up with whatever we do has to reflect the kind of system that we're going to value and input. And I'm I'm not saying it as well as he did, but that in fact is something I prefer to you to read. But I guess that's my question. I'm sorry to be so long-winded. What is it that is the philosophy to reflect that philosophy?
I think, there was a statement that, Director Johnson made, maybe a couple of years ago now, that I very much connected with. Because he said that he intends, and I'm paraphrasing, that he intends to put in place a facility that helps the paradigm shift from what some people saw as punitive correction, holistic and restorative and re-entry focused. That right there touches on, to me, on so much of what this facility needs to do. And he continued to say that we have an opportunity here to change how corrections in the state of Hawaii is done moving forward. And from the facility point, from the architecture, it's a catalyst. It's a catalyst of what future buildings might be. And it was so concise that it stuck with me. because we don't always have a client that's able to say so few words, like the vision that he wants to, see this building fulfilled. And I hope that this is answering, your question a little bit.
Thank you so much, and thank you, Chair Pettis.
I'm gonna try to be brief. Forgive me if I get a little excited here. The trend nationally is to do away with cash bail, because cash bail is transactional. It doesn't necessarily measure public safety. It measures the width of your wallet or your pocketbook. A millionaire makes bail. Some houseless person can't even afford $1. So, Bettina, it's not on you, but we need to work together with the judges and the system. And the other thing that's happened, Bob Merce wrote a paper called Getting It Right. Have you read that, Bettina?
Absolutely.
Okay. I think it's well done. I don't always agree with it, nor does he agree with me, but I commend it. Maybe we can put it in the chat. But if we could get folks assessed early, use the least drastic means, which is the constitutional way of, we should look at all people come into the system. Is there a less drastic way than putting them in a facility like OCCC or a jail or wherever it is? It's really important. So the trend nationally in California, New Jersey, elsewhere, is do away with cash bail. Do you have any thoughts on cash bail? Or is that not in your kuleana?
Would be inappropriate for me to speak on behalf of the team on this right now. However, I believe there is nobody on this call here that would disagree that we need to look at that. There have been to correct the responsibility in the school bail situation. There's been I think it was 2 years ago. I think it was 2 years ago where bail reform bills going to the legislature like the year before. And I was speaking after Tina Maynard in person. I was flabbergasted that they didn't make it all the way through. I feel we cannot give up. We need to look at stripping away back to my role on this project here. We can only work with the rules, the laws, and the policies that are currently in place. And yeah, I think that says it, that are currently in place.
You said it well. The problem is we live in a world that's felonized, and that we think the criminal justice system is going to help someone. In fact, it hurts them. In a hospital, it's called iatrogenic disease, the harm caused by the care. That's why they don't want you to go into a hospital. That's why you go to it's the same thing here. I call it jurogenic effect. People need not be in there. What are they going to meet inside? They're going to meet gangs and trouble and mischief and unfortunately fatalities. That's why we in this commission take very seriously any illness or death and particularly with our older inmates. So I probably said too much already, but the bail thing pops up, and I think we had a shot at it and it didn't work. I would like to take another shot at it. No cash bail, which measures your wallet. That's it.
I just wanted to bring up, Bettina, what Tommy had to say about wanting to abide by the new. I think unfortunately his actions belie his statements, because for the sentence felon population, Kulani continues to only have less than 50% of its beds filled, only has 51% of the beds filled. In the neighbor islands, work furlough participation is very low. The last time we were in Maui, there were only 2 inmates participating in work furlough. So therefore, the new mandate requires reentry as being a major part of the system. It ain't working. So again, I just said my piece.
Good, thank you.
I just want to say one thing very briefly. First of all, thank you both so much for this presentation. I recognize that sometimes this can be a difficult space to come into and present because a core part of oversight is pointing things out and saying things as. And to Martha's point, you know, again, I'm really glad that it resonated with you that, you know, when the director says that what some people may see as a punitive system must be corrected. It's very concerning to me that anybody would define the system as what some people may see as punitive. When you look at federal standards, when you look at best practices, our system is punitive. There is that when you, not you personally, but I think when people use like diminish where we are right now, like what the truth in it is, I think it makes it very, very hard to concretely figure out where we need to go. That to say that again, like as an oversight entity, one of our core jobs and missions is to be very honest and very straightforward about where things are at right now and also where they can go. And so I just wanted to make a comment, and I feel very strongly that, you know, it's not what people may see or what people may consider. No, it is. Like, it truly is a punitive system. And I think that's why, you know, the community and commissioners and all these different stakeholders are so passionate when we're talking about massive, massive projects to try to make that shift and make that change. So I just wanted to comment on people so much again for your time, your work, your effort. I realize this is a monumental project that's taken so long. And so I really appreciate, particularly you retaining your dedication to this and all of your work you've put into it.
And your competence and your dedication to this, I appreciate it.
Thank you, Tina.
I really appreciate those kinds of words. Thank you. Thank you very much.
It's 10:30 right now. I gotta hold this to Tina that you are the vendor for sauna or most of it. What is the 2026 legislative ask for this project right now?
There's no 2026 acts yet, 2025 acts.
Ask. What are you asking
Oh,
for
ask.
this? What are
Oh,
you
what are you
asking
asking
for
for?
in this
Yeah.
legislative session to continue the project in regards to the new OCCC deal?
We're not asking for anything for the OCCC legislative session. We have the 15 million, we got July 1st, and then the 15 million of the upcoming July.
It's the second year of fighting.
Okay. Thank you, Sana. That was what we needed. Thank you. Sana, we want to make another request for that engineer study on the OCCC renovation possibilities. The engineer study that was stated by the public, we had asked once before for it that stated that the OCCC renovation was impossible. We want you to take down that we're asking for another report on that. And we understand this whole process in building a new jail is like a triangle, right? With DCR on the top, the planner, and DAGs. But you folks are overseeing both DAGs and the planner, so we're going to ask you for these reports. Has there been any alternative studies outside of the engineer's report or other studies on the operational integrity of OCCC? So that's another question right there. I would like to see, if possible, all the legislative funding that was giving over the last 3 decades that funded each of the phases that Bettina talked about. So she talked about 3 phases, 2 that have already that's currently been working on at this time. Bettina, is there a working design? There was an RFP in previous meetings that we heard went out for design. Can someone update me on that?
we,
And to design the actual facility.
so there, we are designing the facility right now, but it is a little bit confusing to some degree. It's really, it's different delivery model than method than what we are, we meaning most of us in Hawaii are most familiar with. What the traditional methods are design, bid, build. So there's an architect, and there's consultants that designs the facility. Then it goes out to bid. There's a bunch of contractors that say, I can build this for 10 million and I can build this for 15 million. Then the client makes makes a decision and a contractor builds it. That's what that's very traditional. Then the design build, where essentially the contractor is in charge, the architect is under that contractor, and that team at the beginning, they design, they have the project, they have efficiencies, and they build it. So one entity really for the entire process. What we're doing here right now, that is designing it. We're designing it to that point. Is just enough information on how that the same differently. Then makes of VCR 45 all the places, all the program spaces that there. We have this. These plans can be used to build the project. However, these are called bridging documents that essentially will step in as an architectural component under their umbrella that cannot be a conflict of interest here. And they will look at, they are experts in construction, in building. They might look at this and say, we can shave off $1 million here by changing this particular component of construction from X to Y. And if that does not, as long as that does not change the vision of the project, it will go. So there are two designs, if you will, the two different entities. Does that make sense?
Yes.
That doesn't even answer your question.
So now that you've answered that for me, I believe the RFP was for who can build it. Yeah, the RFP was for who can build it, right? That's what I'm hearing.
The RFP has not been issued.
It hasn't been-
It has
okay.
been RFI.
Okay. Now, in the process for the design, have we had, I mean, is there going to be a process where the design is shared before the RFP goes out for comments from the community?
Oh, yeah.
Okay.
Oh, yeah. There's, I mean, what you saw today, that rendering, like I said, that is hot off the press. And we are really excited to finally have something that is, that people can look at, that's not just, spreadsheets. And, this is a different level now, and then it's kind of exciting. Yes, we have, we are in the process of developing floor plan. So this is moving rather quickly right now.
Okay. Just a real quick note, Barbara, in regards to in-person visits, that's really a policy issue. And it's a national best practice to have physical contact, your visits throughout the correctional environment nationally. Yeah, the issues we're having in Hawaii now goes against those practices. Okay, so the question that you asked, whether or not there's going to be an in-person visit, most of the jails, almost every facility is equipped for in-person visiting. Yeah, they also have non-contact options as well.
Right.
Yeah. So I just wanted to share that with you so you understand that there is an expectation that there will be in-person visiting at this facility.
Contact.
Contact, yeah, contact, or not in person, it's contact. It is a national best practice. Yeah, so if you're gonna quote nationally that you're doing best practices in your correctional system, that includes contact visits.
What's also interesting about that, just to add briefly, is after the last legislative session, Senator Elefante actually put through a Senate resolution for the Department of Corrections and Rehabilitation to incorporate this at all facilities. If I'm remembering correctly, I think that, but I'll go back and check. But this is something that the commission is definitely concerned about for all facilities, and something that we continue to ask about and push on, especially when we go to facilities and see what's happening. So thank you so much for bringing up that point.
Thank you, Barbara. Thank you, Bettina and Sana, for this conversation. I know there's more and more work to be done. Thank you, Sana, for taking down those requests for me. Get back to us when you're ready. I just want to make a quick housekeeping. Brother, are you from a community?
No,
No.
I am.
Okay. Anyway, I just want to make an announcement that when I say public testimony, that includes everybody in the room as well. You know, I was only focused on the TV right now. So some individuals have left and I apologize. But when I talk to public testimony, it includes those of you who are in the room as well. And there are individuals in the room. So thank you very much. Let's move on at this time to the overview of the Oversight Coordinator's report.
Okay. Thank you. Hello, everyone. My name is Kristen Johnson. I'm the Oversight Coordinator, and by law, we post a monthly report that covers everything the commission or staff have done within the past month. And we also use these reports to post about deaths in custody. So to start off with, unfortunately, in December, there were 4 deaths in custody. On Tuesday, December 2nd, 2025, at approximately 9:20 a.m., a male in custody, 45 years old, was found unresponsive on suicide watch at OCCC. Medical staff were immediately informed and directed staff to call 911. PCR records indicate the department arrived around 9:38 a.m. and EMS arrived around 9:45. PCR records also indicate that the defendant was transported to the hospital at 9:57 a.m. and was pronounced deceased at 10:00 at the hospital. An autopsy also the official time of death. And on Friday, December 5th, 2025, at approximately 11:46 a.m., a male in custody, 48 years old, was found unresponsive in a cell at Halava. Security staff immediately began CPR until medical staff arrived to continue that CPR. But at approximately 12:17 p.m., EMS arrived on the scene and transported the defendant to the hospital emergency room at approximately 12:26 p.m. This cause of death does appear to be a suicide, but again, an autopsy will determine the official cause and time of death. On Friday, December 19th, 2025, at approximately 6:20 p.m., a white male in custody, 34 years old, at Halava was found unresponsive in a cell. Security personnel immediately responded to 911. EMS arrived on the scene at approximately 7:15 p.m. and approximately 7:46 to be a suicide, but an autopsy will determine the official cause of death. And on Thursday, December 25th, 2025, at approximately 1:51 p.m., a male in custody, 74 years old, into PCR custody on December. The circumstances leading up to this death are very unclear and still being investigated, but an autopsy will determine the official cause. So again, we will continue to report out and focus area for 2026 for us, looking back years, looking at autopsy reports, looking at the cause of death for the department to try to figure out how to prevent deaths in custody. I want to say OCCC for the last. I didn't include the facility was positive as OCCC. It is OCCC. The report is obvious. Okay, investigating all of our prisons and again, just expand our availability to look at systemic reviews and also individual complaints. So thank you for joining to really expand our investigative processes for 2026. We have quite a few of them. So I'll go through them quickly. But our staff, This was a very incarcerated women participated, inviting us to that. Our version inviting us to that. Helpful. All of the county prosecutors were there, and different stakeholders, and so we appreciate being invited to that as well. And in addition to that, our staff actually observed several hearings at district court, presided over by the Honorable Deputy Chief Judge Melanie May. This was very, very helpful for our staff to kind of understand how diversion can, so we appreciate being able to participate in that. Our staff also attend in those types of settings because the population is so transient. And so the fact that the last event that we attended was, which covered critical components and takeaways, extremely helpful for our staff because, you know, case review and compliance and looking at 15 key indicators, actually uploading all of our current cases that we have into that system, use it to dive into the investigative function of just using it for an actual case management of keeping track of all the notes and documentation. Investigative function of just using it for an actual case management of keeping track of all the notes and documentation. So thank you, Chair.
I want to congratulate you. I feel like, I think in the past, the commissioners had requested of the Department of Corrections and Rehabilitation to help. You know, I want to know, for example, if help. You know, I want to know, for example, if it would be, I would cases of why this is happening and what can be done to case it. Thank you.
Ron, when you're
Go ahead, Carrie Ann.
Year that may be again a record number, following up on coffee. To just add that there's continues to be a lack of transparency, which also means lack of accountability relating to death in custody. Community members are interested in learning more about these specific deaths. If there's drug use involved, you know, there are periods of time where you hear of high rates of drugs being smuggled in, particularly into Palau and elsewhere. How does that play a role into these deaths in custody? For the deaths that may appear to be suicide, how many of them are actually determined to be suicides, or are they just appear to be suicides and in fact something else has occurred within our jails and prisons? That's been something that I've heard from people who have been incarcerated for years on end about who are elsewhere, and how does that play out in custody? Thank you so much.
Thank you. Any other, Kat?
I have 3 issues. One is that's being considered for OCCC. If it's core civic, we have.
we can't do enough, as Ron says, for our Pahau.
Commission is in, we have been concerned. What has been successful for us is the fact that the legislature has given us staff. Right, with the jail investigator last year, with the prison investigator now, we can look more in depth to all.
May not, and because of that, that was a big reason out to the public. But when we're all type of trend, medical examiners, our injuries or anything that's being noted, and we're creating a very large, thorough, timely database that's going to have all this information. The highest year that we've had with deaths in custody, we're going to be able to answer that. You know, is that previously haven't even been probably thoroughly looked into, we're going to be providing that. A bit is some of the fine, but it's something that we're continuously working on. This is going to be something from stakeholders who we're very close with this year, hopefully within the next 6 months, if not sooner. Unfortunately, the true death investigation does take an extended period of time, and even autopsy reports just to figure out to get from the medical examiner or coroner or requested them, they have it, processes can take. And so the information that we're trying to put out is information that we know is at least we have. It appears to be suicide. Again, that's important to us because we don't want to wait and say, you know, this is what it seems to be. We want to know in real time so that, again, we can continue to make recommendations and continue to make informed decisions. So for feedback or wanting to set up a meeting with me or talk more, I'd be more than happy to do that. All of our contact information, including our email or our website.
From the commissioners.
I'd like to respond.
Go ahead, Judge.
Yes, question and comment. I just want us to respond, in response to some of the comments about some timely and unfortunate deaths. It's important for you, I know you know this, as members of the public, I'm sure you know this, but I guess it's important for us to also, for us to say, that we have a family affected with each of these deaths. It brings sadness. Easy to get this information that she does. I've watched it from CNCR, that she set up a meeting and I went with her, meet with the agent, why we want to get given information that was required to be provided in different forms multiple times. And sat in different forms multiple times. And so as we go forward with the future, hopefully we will go, as we go forward with the future, hopefully we will be able to address this in a way that provides more transparency for all